Hi, our guest today is Ellen Freedman from the Milford Regional Healthcare Foundation. Ellen, welcome.
Thank you.
And we're here to talk about a complex subject, which is the Community Health Improvement Plan.
What do we call that?
That you're
CHIP.
an effort that you're leading that is coinciding with the opening of the new wing of the hospital.
Right. Well, the Community Health Improvement Plan is being developed with the CHNA 6, and the CHNA is the Community Health Network area. So we have...
Which the Department of Health of the state designates these CHNAs all around the area.
Exactly.
And 6 is the town served by Milford Regional Medical Center.
Right. So there's about 13 towns in CHNA 6. And actually, CHNA 6 is going to be celebrating its 20th anniversary, so it's been around for a long time.
Yep.
And we have embarked on this pretty much an 18-month process of creating this Community Health Improvement Plan, as you mentioned.
Now, I should fess up and tell everybody that I'm, as a volunteer, I'm part of that. So Al's left out of knowing what we're doing.
I'm trying to figure out what CHNA is.
But we'll bring him in the loop.
Nah, that's okay.
But what happens, maybe I should summarize it, or you can. As part of the addition being built, a certain percentage of funds comes back to community organizations to boost the health and welfare of the citizenry in the towns.
Right. So that's called the DON, or the Determination of Need. And
this plan will guide how that money's spent.
Absolutely. And the over the last 5 or 6 years, we've been using funds from the completion of the Cancer Center in Milford, and those funds have been depleted. So the timing of this is wonderful, that the new building is being built at the hospital. It's also a significantly larger amount of funding, so we are more obligated to really come up with a very good plan for this fund.
Right. Just to give an idea of the order of magnitude, we had about $16,000 a year for the last 5 years to spend on various community activities, and now we're going to have close to $2.8 million to spend over the next 5 to 8 years.
Right. So we're trying to extend that. I mean, 8 years would be our preference, just because we haven't had this kind of opportunity, and it's going to take us a little while to grow into that. But we have about 90 organizations who participate, and I think more and more people are starting to hear about it and really want to be at the table to help with the planning.
And hopefully get some of the funding. So what are the 4 areas that the plan concentrates on?
Well, you have the cheat sheet right in front of you.
So does Al.
So does Al.
Right,
we're dealing with looking at access, which is access to health, but also social service, and all sorts of access to in terms of transportation as well. We're looking at behavioral health and substance abuse. Also, chronic disease and health promotion is an area, and then violence prevention is the last area. So we have in each one of these areas goals, objectives, and strategies that the groups are working on, and together that would form the Community Health Improvement Plan.
And then it follows then that the funding would be applied against the plan.
Yes. Right.
Now, is that $2.5 million over the 8 years, or is it per year?
Over the 8 years.
Okay.
Over the 8 years. And I think there is funds to allow for an infrastructure so that we can support the work with a process and accountability for the funds. We will be setting up a grants distribution process, and as soon as the new building is occupied, that's pretty much when the funds will be available. So that could be the fall,
targeted,
next fall,
targeted September.
sometime between November and January.
We're talking, I'd say, January of 2016 to be safe.
Yeah. Right. So we have really worked hard to share this with the community, so that we don't want people to find out about this later and have missed the opportunity to participate. So I think that's why this is a great opportunity to come on and share this with your program, and to let people know that you can still participate in this process.
So it'll be you'll fund. So if I understand what you're saying, you'll be funding organizations via grants.
Exactly.
Ah, okay.
And we hope that the organizations that come to the table will also collaborate with each other to really put forth the best proposal and really do the best work. We have just, a lot of potential with the organizations that are here.
It's not limited to anybody. Anybody who puts together a program in these 4 areas can apply for a grant.
Pretty much. I mean, we want the organizations to have participated in the process. We want them to be part of the CHNA, which really only means showing up. I mean, there's no dues, there's no requirements. It's really just.
Why don't we go through some of the organizations that are currently there?
We have
Dozens.
Dozens. We have mental health agencies. Almost all the mental health agencies in this area: Riverside, Wayside, U Inc. And family continuity. We have schools. Any schools in these towns we all are always trying to get more schools. And some schools are there because they want to talk about school food programs. Some schools are there because they have priorities around behavioral health. Some have issues around violence prevention with dating violence. So BVT, Blackstone Valley, for example, has participation on the Violence Prevention Task Force, and they're looking at programs around dating violence prevention. So really, that's, so schools are participating. We have
That's every church in the area.
Churches in the area. We have the Board of Health. We have councils on aging. We have the Hockomock Area YMCA, Edward M. Kennedy Health Center, the hospital, many people from the hospital.
No, it's not the Board of Health, not limited to Milford Board of
Not
Health.
limited to Milford. In fact, one of the goals of the Department of Public Health is really to work through health departments, regional boards of health, I should say. And when you're looking at small towns, it's a little harder to access folks working part-time, or the staffing is somewhat limited. So we are trying to pull in that population as well to work with the local boards of health. And in fact, Milford did just get some funding through the local boards of health with the Hockomock Area YMCA and the hospital to do something called Mass in Motion, which is a grant to promote physical activity. So even while we're looking at this long-term process, people at the table are also working collaboratively to access funds that are available through many other sources.
So what do you have to do to sit at the table?
You just
Come to the meetings.
Come to the meetings. We meet every other month, and then we, as a group, and then we have our work groups have the alternate month have a meeting. We can come to the
So
hospital
the
website to find
The next
out.
general meeting is in May,
Right. The next general meeting is May 8th, and then there's another one June 5th.
and they are at the Milford Senior Center
yeah.
from 9 to 11. Those are Friday mornings.
Yeah, and you can put that maybe up on the screen, or how to get in touch with me. And I think the work of each work group, there are facilitators who really try and keep the work moving ahead. We have technical assistance. We have support from a group called Health Resources in Action, and they're sort of trying to keep sort of us, the facilitators one step ahead of the process, just so the groups are all moving in the same direction. So it's really it's kind of a huge undertaking in a sense that. But at the end of the day, we will have a final product, and I hope it's something that people are proud of. Greater Worcester area has developed a community health improvement plan. Metro West area has developed a community health improvement plan. And in fact, in Worcester, every year they revisit it and they say, what goals have we reached? What is the status of our plan? Also, the hospital has a strategic plan that does align with a lot of the same work. We're all looking at the same health assessment. So every 3 years, the hospital is required to do a community health assessment for
Of
their
what are the issues in the
for
area.
their not-for-profit status. So we're about to do the 2015 survey. We've been using data from 2012, but we will be updating that. And so that being done at the same time, I think is really going to give us a lot more information and give us a lot of momentum.
And some of the things we're finding, actually, I'll run through all of the areas.
Yeah.
Transportation has popped up as one of the biggest issues for everybody, no matter what town they're in, how to get people from place A to place B and back home. Because we have no public transportation in this region.
And when we're talking about
We do in some of the hospital-served towns, we don't in the majority of them.
Right, and it doesn't seem like such a big, huge problem when you have all the right people at the table, and these people work with other groups and other constituents, and they bring that information to the table. So actually that issue of transportation, which is a big issue, is now kind of moving towards in a direction that we can actually see it maybe happening. So there's things like that that are very they're very exciting.
And other things, obviously, behavioral health and substance abuse is no denying there's an opiate problem in the region, or in fact the country.
Right. Another example is in the chronic disease prevention group, they're looking at healthy eating, and in the access group, food insecurity, people not having enough food is an issue. So those two groups do have an overlap. So there is merging between these, as Kevin was saying, between these groups. And it's kind of exciting to see where the overlap is, because then you have even a stronger commitment to making something happen. I know, Al, you're involved with the Humanitarian Summit, which is looking at food security. So
And
many
Father Mac,
Father
chairs
Mac,
that,
many of the
is
same
part of
people
this.
are at this subcommittee.
Well, we're looking at other things
besides that, but that is
transportation is another.
transportation too.
And I also happen to be the chairman of the Board of Health in Upton, so.
Right.
And this is the first I've heard about it, so.
Right. And I think that the boards of health has been a struggle, because there's so many towns, and the affiliation has been sort of hard to get a handle on. But I think that really is our next step. In fact, we are starting to pull together that list. And I did see that you were on the Upton Board of Health, so that would be great to get you involved in that capacity. I think one more committee, but I think the boards of health do have a unique perspective, because where we're talking about so many different topics, the boards of health often cover pretty much all of the topics.
Yeah.
Well,
same.
significantly, yeah.
Yeah.
Interestingly enough, if there is an emergency or something like that, then the Board of Health becomes scene commanders, that kind of stuff. So there's a lot of things the boards of health are involved in that are not necessarily linked up to the hospital, but it would be nice to be, because it would be a resource.
Absolutely. I mean, I think the other thing is we're looking at this like 3,000 feet up, and this is a population health exercise. So almost everyone is in the trenches doing the work, but it's a challenge to just say, step away from that for a minute, and if you had $1 million, where could we make the biggest impact? And together, where can we do that? And so it's a challenge for people to sort of step away from their own agendas to try and do that.
Absolutely.
I think in line with that, the most interesting part of this process is when you say stepping away from your own agenda, you have over 50 groups.
Yeah.
And everybody, of course, wants a piece of the pie for their group.
Right.
But in the planning stage, they've worked together with everybody collaboratively to say, well, what if we all got together on this issue? What could we do as a group?
Right.
And how do we define the issue, not from my single perspective, but from the broader perspective? And that's how we have 4 priority areas, and I believe 8 objectives or 9 objectives among them.
Right, and people can ask themselves, what am I doing now that can contribute to this, to solving some of these issues? And things can be replicated. I mean, if it's being done in Uxbridge High School, and why not try and do that at half a dozen other schools? We want to look at these best practices, these models that have been shown to be effective, and there's lots of opportunities around diabetes prevention, things that have been shown to be effective. Let's replicate them. Let's look at different populations. We might have to adjust when we see the rates of diabetes in our community. We want to target the right populations, but we have the programs out there.
Well, I think there's some other things that are significant also, that, violence in the schools, and I think that we have a significant drug problem. I mean, opiates has become a significant problem in the area schools, and it's something that seems to be, everybody acknowledges it, but there's no programs in place, not major programs that really go after that.
Right. I mean, I think the paper today said the 200 opiate deaths as of the first of the year in Massachusetts, excluding major cities, Somerville, Cambridge, and Boston. You're excluding 3 of the largest cities,
That's
and
right.
you're still getting 200 deaths as of January 1st. So there is a task force that's going around the state that the Governor Baker is initiated, and there was a task force even under the last administration. And this is, there are things that are starting to happen, but I really still think it's not enough. It's definitely not enough.
The other thing to point out, though, Ellen, about the plan is not words on paper and then let's throw
Money at it.
$2.8 million at it. There are going to be very clearly defined, and one of the things that's interesting is everything in that plan has to be what's called actionable with a time frame listed. So that to get funding, you'd have to look at it in a plan and say, well, you promised to do this by that date. because the money's going to be gone after a couple of years. So
Well,
you
so
can't,
what
you can't just throw it at an effort or hire 20 people and then get them all laid off for
You're
5
looking for
years.
sustainability.
Right,
The
right.
real core issue is sustainability.
Yeah.
Who the hell- I'll get that word out eventually.
So in some cases, it might be piloting something.
Well,
In other cases, it might be
you have to look at
supporting another effort.
whether or not it can be continued over the
Right.
long haul once the funding goes away.
right.
If it can't be, then why invest the money in it? Because you're trying to put together programs that are going to live
Right.
on.
But it might be giving an existing program a shot in the arm to bolster it while such as the opiate problem is crying out for help. Maybe you could bolster the efforts against that for a couple of years.
Right. I mean, we run into this all the time with grant funding. We just completed funding from the Executive Office of Health and Human Services to provide behavioral health services in the emergency department at the hospital. We had a really very robust program, and the funding ended, and the hospital is continuing to provide that level of
Right.
care, but that is not always the case. I mean, those things
Sometimes the
can
funding
go
goes
away,
and they go away.
and that's people's jobs. So it is a risk to take on some of these new initiatives, but the programs will never get better, as Kevin was saying. We'll never really sort of move the needle, if you will, if we kind of just keep doing things the same way. We have to really try those kinds of new initiatives and bring new partnerships together and get really creative. I mean, it really is about getting very creative. And you don't know when the next funding source is available. Something could be coming from nationally. I just looked at SAMHSA, the Substance Abuse and Mental Health Administration, grants around educating around mental health, educating teachers, that you need to look for signs of mental health in your students. I mean, it's not just enough to, you need to know what to look at. Signs of suicide, signs of depression, because it is so epidemic in the schools. So parents need that education. And it's very systematic in terms of how that needs to be done. There are programs to do that, but once you decide, well, this is what's needed in our community, then you can
Dating
unroll.
violence is
Yeah.
the same thing.
Then you can initiate those kinds of programs. So, we don't know the answers, but it's coming up with some of these solutions and seeing the ones that really have the most
Well,
impact.
you have the questions.
Yep.
What you have is you have the questions, and now you're looking for someone to come up with some of
strategies,
the
yeah.
strategies to come up with the answers,
Yeah, yeah,
or programs to do that.
right. And I think that's kind of how public health has always operated. Prevention never got any funding. It's getting more funding now, under the Obama administration. But a lot of it is prevention, because if you don't start it with the kids really young, or if you don't start the programs at the, really at the, sort of at the beginning, then you run into a lot of these bigger problems. They just grow.
It's kind of an interesting situation, because what I also belong to Rotary, and one of the things that Rotary International looks for is sustainability in any programs. And so as a result of that, they analyze what you're going to do before they throw money at it.
Right.
But as time goes on, money comes in. For example, Bill Gates has given over $333 million to Rotary to eliminate polio in the world. So,
Huge.
and we've been doing it for 38 years. So in the last 4 or 5 years, his fund has thrown money at it, and we've been very successful. So that's the kind of sustainability that you're looking for. So as time goes on, somebody else will jump in the fray.
Right. Someone you can prove that it works.
Right.
That's,
then
the
it goes
technical term, I believe, is evidence-based programming.
Yeah, and that's what I was
Ooh,
saying.
wow.
That,
Big words. I didn't know you
Well,
know
that's what
That's what I was saying.
Oh, that's why
that-
you're on the committee.
That's
You
why
know
I'm
the
on
big
the
words.
committee. I know the big words.
And I think that's really what we hope to achieve. But again, we're looking at so many different topics, and but there are people who have strengths in these issues. But if people come in and say, I want to do something on polio, I mean, well, that's not our priority area, because
Right,
not
no.
no, but that's
There's
not.
a-
I'm not just using
yeah.
that as an example. But that's why we've looked at the data to say, well, they're not the only issues, but you really have to narrow in on some of the highest priorities. So I think I think we've nailed it with the priority areas. And as I was saying, the hospital also has a strategic plan based on the same data, and there's alignment that's not exactly the same, but both can support each other. Which this is the only hospital in this Chenal 6. Some other Chenals have multiple hospitals, so we actually have a nice opportunity here that we have alignment with the hospital and we have so much expertise and talent there that we can really see some of this happen.
But the interesting thing is, since it's tied to the hospital's growth, and I don't think after the completion of this building, the hospital has immediate plans to go build another $55 million wing, we have to make the money count over the next
Right.
decade or so.
I don't know where they'd put it.
I do.
Building up.
Go up. Well, this one's being designed so they can go up,
Yeah.
but
And I think through the whole process, there has been a lot of, just a huge amount of collaboration. I mean, even learning new partners. So the Hockomock Area YMCA is involved, for example, talking about some of the programs, and the Whiten Center says, well, those are definitely initiatives that we would like to embrace. We have a similar, program, similar institution. We can do some of those. And I think that that's really where the work is getting done, even before the funding comes about, that people say, well, that's something that we can do in our community.
well, the nice thing you've got a head start on it.
Yes,
It-
absolutely,
And you have a
absolutely. I think
network
people
of
come.
people.
Yeah, people have come in the spirit of really trying to bring their best work, and I think it can be a frustrating process because, maybe the next meeting, the same people who came to the last meeting aren't there, and somebody else has a different agenda. It is kind of exhausting. But there is light at the end of the tunnel. I mean, there is an end point. So I keep, having people, who feel that way to say, just, hang in
What's
there.
the attendance like? I mean,
It's a lot.
50 to 60 people.
50 to
Really?
60 people come to the meetings.
And I'd say about 15 or so at the 4 separate group meetings.
Right.
Oh, wow.
the group
But
meetings are well
just let me
attended.
give you an idea of what's funny. I mean, sometimes you have to get people talking the same language in a work group. For instance, the access group, access means two things to different people. You had some of the people thought it meant access to health care, and some other people, myself included, thought it meant transportation to that health care. And the two groups had to find a way to talk in common
Right.
and understand each other and come up with objectives that satisfied both.
Interesting.
I mean, the other common language is, to really serve the most underserved population. That's what we're here for. And so that does cut across all the groups. So no matter if you're talking about behavioral health or violence prevention, it's really who are the most vulnerable populations that really can't get the services or what they need or the information without, additional resources, without, these programs, without really some significant, thought. So it is that evening that health disparity, if you will, that is kind of a new concept for a lot of people. But I really think that people are very open to learning how to work together. I mean, it's kind of amazing.
Well, it's rather interesting because what happens is when you bring a lot of people together, all of a sudden there's certain things that have in common, problems that sit right up on the table, and then you can wrap your arms around those. But you have to get people in a room to talk about it first.
Yep. Right. So when you talk about chronic disease prevention, it's a huge topic. Are we talking about youth obesity? Are we talking about the needs of the elder population? And it's still in play because it's I don't think things are going to be wait till the ink dries, so to speak. Things are definitely still in play. And
Well, sadly, I don't think the problems are going away.
no
Oh,
problem.
wow. I was kind of hoping they would. But
But it's a really exciting process, and I do encourage people to to find out more, to get involved. You can go on the foundation website under community benefits, and we have the information on the brochure, and also the Chenal grants that we funded this year. There's some small mini grants, and so those are also listed on there. Things from work on trauma education for providers and health fairs, or some of the other things we funded
Oh, I've
this year.
seen this. I got this in the mail.
The boy, I can't remember all
Okay.
of them. I'm on the grant reviewing committee, and I can't remember all of them. But
Yeah.
over the years, they've been in the $1,000 to $2,000 level,
Right.
and I'm trying to think
We're
of
doing
some
something
of
this year on diabetes prevention, know your numbers, and access
them
to
through the Hockomock Area YMCA. They just did a fair for kids in the Northbridge area.
Yep. Beginning bridges, and we've provided the youth center with some equipment to have youth and
And senior
seniors
fitness programs.
work together with fitness. So,
Here in Milford?
yep.
I think over the last couple of years, on an ongoing basis, we funded the nursing operation at BVT in one way or another. We've given them funds to do programs.
Yeah.
That's turned out to be a good program,
Yeah.
too.
And right, we're very proud of that program.
And,
Very and they've added more behavioral health. Riverside is the behavioral health provider there, and so they've really addressed the needs of the students. And there's a nutritionist there who says, well, it's not just emotional health, or emotional health is impacted by what you eat. Did you have breakfast today? What's your diet like? And so it's coming at health and wellness from so many different directions. But that's the beauty of having something right at the school. Edward M. Kennedy runs a health center in Framingham and in Worcester.
Right.
And
now Milford.
And now Milford.
Well, they run a health center in Milford, but not a school-based
okay.
health center.
Yeah.
So we do have the Edward M. Kennedy, which has contributed significantly. And again, that comes at a price, but we, for a long time, knew we needed more primary care and affordable primary care, and it's been a huge contributor.
Yeah, affordable primary care. Because what happens is that if you don't have that, then it drops right into the emergency.
Right.
At the hospital. So you pay now or you pay later. So what's happened is we've moved some of that to a more convenient place where you can focus on those needs of the people that need it, as opposed to where emergency happens.
Right. We did track the patients that were coming to the emergency department with outreach workers and referred to the health center for the primary care needs. There are about 1,200 patients in 8 months.
Wow.
But just to
That's
give
a
you,
significant. That's
no,
a significant.
but just to throw in where the transportation problem throws in on that, the hospital might refer people to Edward Kennedy.
How do they
But
get
Edward Kennedy, how do they get there? But Edward Kennedy might refer them back to the hospital for major tests. How do they get there?
Well, that's a discussion
Right.
we've had at the other meeting that I
Right.
go to on Saturday mornings,
Right.
where transportation it's easy. It's more convenient, I've been told, to get to Milford Hospital from the Cape than it is if you live in Milford.
Yes, it is.
And which is kind of an interesting situation.
But our next guest of the next show after this is Harold Rhodes,
Yeah,
who's
Harold-
working on the
Who's
transportation
working on
problem.
that? Yes,
Right.
Harold's
And
been
Harold's
working.
going to explain that because he's
He's
come
really
up
been-
with a pretty good program for
Right.
It looks
starting in
like
Milford.
it looks like it's finally someone sat down, and Harold's done that
Right.
and put it all together and set it before the Board of Selectmen, and is
Absolutely.
rolling that ball in the direction.
Absolutely. And
Slowly but surely.
and-
Well, it's moving.
Yeah, I mean, we are now part of the our WTA, which he'll talk
For
about.
Framingham, yeah.
And it's moving people around Milford, but it's also connecting them to major hubs, so we can bring workforce in. We can, there's lots of potential.
Yeah, right now you have to, if you're going to go someplace else out of this town, there's a bus in the morning and a
Right.
bus at night,
And that's it.
That's it.
and
It
Not
only
very
goes to
reliable.
and it's not very reliable,
It only goes to Framingham.
and it's not reliable. So
Well, that's actually not the need that Harold found.
no,
The
there's
need is getting from point A in Milford to point B in Milford, and then back to point A.
Right.
right. No,
And just looking at the number of people who come to the cancer center for visits and come to the hospital. I mean, the cancer center in particular, because if you're there for treatment,
Yeah.
you are coming on a regular
On a
basis.
regular basis.
And every time you come, if you don't drive, you need to find a ride.
Right, right.
So this is that alone is a significant effect of having transportation. And as you mentioned, getting to the health center.
Well, the other dilemma is if someone says, well, why don't you just set up a volunteer organization to do
They don't
right?
work.
Well, the problem with volunteer organization is twofold. First of all, you don't get reliability out of it, number one, and number two, you have a liability issue that is
With the insurance.
humongous.
Right. I mean, you can do that anyway. I mean, a lot of communities have neighbor brigades and help people with rides, which is a great alternative. I mean, for a lot of these things, it isn't just a one size fits all. You really want to look at multiple
creative.
responses, and I think that's there's a potential there in this plan to really look broadly at a lot of responses and try and make a difference.
Ellen, we've run out of time already on
Okay.
this. Would you be willing to come back in, say, January or February of 16 and talk about
We
when the
have
plan
money.
is written and the funding starts going out? Would you come back and talk about it?
Absolutely.
Good.
Thank you.
All right. Thank you very much
Thank
for your
you.
time.
Thanks.